When I had the opportunity to think about what next to do, I thought I would do something in global health. I remember after delivering so many babies when I was in medical school, I used to say I would never get pregnant. I would never have children because I saw so many women die. And the question is, why would women lose their lives to bring a new life into this world? And why can't we do something about it?
Professor Olodoshu Ojumbede is director of the Center for Population and Reproductive Health. He is one of the continent's premier women's health physicians.
Indeed, sometimes, after 70
One of the reasons I got into medicine was that obstetrics was a very practical subject. That's a problem, you see it, you solve it, you are happy, the family is happy, everybody is happy.
One of the challenges we have realized between science research and policy and practice is that there has been a gap. Policies were not informed by science, and the services were not even responding to the causes of the maternal mortality. I think things will change. The way we drive our research, the way we innovate with our ideas, this gap can be bridged. By leadership, by networking, by forming collaborations with people from other countries.
What we really want to do with our Global Health Initiative is to bring science into the disparities that we're talking about.
Can you guys do cross-match for minor antigens and all those things, or you're just...
These are not routinely done in Nigeria. They are done at research level and examination level.
And what we can do, those of us who are in the diaspora, is be in solidarity with them.
You have storage like this?
This is far from it. This is far from it. Most times there's a dire need of, because we don't have voluntary donors.
We can work with our colleagues in Nigeria. They can take best practices from here. They can change it to fit the local environment.
We know that blood is life and it is a need. Sometimes in Nigeria, these blood bags are not available, so a big jar is wasted. You use it and you dispose it. But now, something that is 500 ml can be put in small volumes and can be used by many children all at once.
What's even more remarkable about this is that we can also learn from them. When we begin to think about how you improve health in resource-poor settings, it could have significant implications for us in America, because more is not always better, right? If we can do something cheaper, why not bring it back here and do it cheaper, as long as it's effective? So I really see this as a collaboration. I see it as a partnership where we're learning from Nigeria, and I tell you, there's a lot of wisdom in Nigeria. I know Dr. Ojumbede is a brilliant man. He might be able to teach us something that can help us on the south side of Chicago.
My work with the Global Health Initiative came about when I was asked to be on the steering committee because they really wanted somebody who was interested in population and reproductive health. It's really exciting that there's the opportunity to work with people in Nigeria.
Yesterday was my first day of meeting Melissa. Melissa struck me like someone who is very creative in mind and very forward-looking in her vision.
Oh, got it. Okay.
To meet colleagues who are prepared to explore new questions.
I think there are a lot of things that have parallels to our country, which is we've been working a lot on postpartum hemorrhage and drills for postpartum hemorrhage.
Who are not sacrosanct about things that should not be questioned, that things that should not be explored. Now, IUDs is the most commonly used method.
My work in adolescent health and primary pregnancy prevention has a lot of applications to issues for Nigeria. We have the same problem. We have adolescents who get pregnant.
Adolescent reproductive health issues are really, really, really distressing back home. Even though they're well informed about contraception, they are not using it.
That's exactly what we're dealing with here, is this idea of if you give them contraception, even if you're using contraception for a medical reason, sometimes parents are like, I don't want her to have it because that just
Yeah.
gives them permission. And so we're trying to think, what could an intervention be? And so the other was, could you provide them with access to health care?
Now everybody is talking global health. There's no American health. There's no Russian health. There's no Nigerian health. There's global health. Because what affects one affects all. People are dying from causes we know. And we're doing the same thing. How can we come together to share our experiences and see how we can fashion out innovative and creative and stylish ideas that can give us better results?